You ever had a patient come into your office and say, boy, that guy up the street, the last dentist, boy, he just did a filling and I'm not going back. My tooth hurts. I want you to look at it. You know, this is the time not to get the claws out and say anything bad about somebody else. You know, and it happens to you too. They come in and they say, you worked at my tooth. It never hurt before. Now it hurts. Well, teeth, like any other joint you operate on or any other part of the body you operate on, it can be inflamed. It can hurt afterwards. And, you know, if you slam your finger in a door, it starts to swell and gets real big. Well, you have a nerve that lives on the inside of that tooth, and it doesn't like to be operated on. And so it can swell a little bit, and usually that puts pressure in it, and you feel your heart beating in there. That's normal, and it should go away in a few days. If you think about what a cavity is like cancer in the tooth, and I or the other dentist had to take all that away using our dental surgery techniques to remove all that diseased tissue, then we replaced it with something. Now, your tooth is a good insulator. I've used teeth to actually identify people after fires. Teeth are thermally pretty stable stuff. Well, the filling materials we use, whether it's plastic or porcelain or gold or silver, they conduct hot and cold right through to the nerve. If I gave you a porcelain or any cup made out of any of the dental materials, a gold cup, a silver cup, a plastic cup, I filled it with hot liquid, you hold on to it and you'd feel what's inside. If I filled it with an icy liquid, same thing, you'd feel it through there. So your tooth is gonna hurt afterwards. Not always. And, you know, for the guys that read things like Andreessen and look at tooth trauma and all that, you can see it can happen right away, right after the numbness goes away, or it can happen a year from now, where you'll eat some ice cream and you'll know, oh, I got a filling in that tooth. And if it's a year from now, you know, hopefully they'll come back and see you, and you can look at it and follow it along and treat it appropriately. But if it happens even right after that filling, and you know that the occlusion's right and all that, you explain that to the patient that teeth can sometimes hurt. And that lends itself, I just mentioned that they're joints, and each tooth is a joint surrounded by a ligament. And I tell the patient that their ligament fibers are ligament fibers, just like in the knee. Now, every joint, whether it's fingers or anything else, has a range of motion, a normal physiologic range of motion. Teeth move when you eat. They go up and down a cheek and tongue, up and down a cheek and tongue. The teeth can move physiologically when you're masticating. When you're chewing food, your teeth are going to move. Now, if you've got a cracked tooth, what can happen is, well, I tell my patients that when you have a cracked tooth, it makes its diagnosis for you. You know, whether you can see it, the patient's history, and when do I treat it? I'll treat it when the patient says, I can't eat without thinking. I can put my teeth together now, no pain at all. But if I get something tough between my teeth, French bread crust, a piece of bacon that's a little tough, and I bite, I get this zing. It goes right away. And I let them know that's a cracked tooth. That's cracked tooth syndrome. And you use your tooth sluice and all that other and show them. And explain to them that a cracked tooth, like any joint, is now moving in the wrong way. You know, my fingers have a range of motion. Well, if I bend my thumb back towards my elbow, I'm going to jump out of the chair. You know, keto and these martial arts guys will do that, and they do an arm bar. There's a certain range of motion that those joints have, and then there's one that's pathologic. But when you have a tooth that goes up and down in the socket and towards your cheek and tongue, and all of a sudden it tries to go towards the cheek and tongue at the same time, there's that little zing you get, just like an elbow or twisting a finger. And if the patient understands that, then they're more than likely to decide when and how, and to get it treated, and they'll follow your advice on that.